Speaking of answers, there's some new questions about President Obama's health care law today as lawmakers from both sides of the aisle are asking for answers about how a provision in the law will impact members of Congress and their staff, let alone the American people. Chief Washington correspondent Jim Engel is live in Washington with more on this. Hi, Jim.
Hello, Jenna. Well, Republican Senator Charles Grassley of Iowa added an amendment to the health care law that forces members of Congress and their personal staff to fall under ObamaCare, losing the current federal employee health benefits they now enjoy.
So the original idea was that Congress shouldn't be exempted from Obamacare. The people should have to eat their own cooking, so to speak.
But many lawmakers and staffers make too much money to qualify for much in subsidies on the exchanges, so some are reported to be thinking about retirement so they can keep their current plan.
If we are unable to repeal the bill, many members of Congress and their staffs will simply be unable to sustain their families and their needs and will go seek employment somewhere else. I believe this will happen.
Now, one Democrat, though, says lawmakers should eat their own cooking.
Well, the law says that the members of Congress should live under the law that we wrote. I completely agree with that. We should be in the exchanges. For the employees, the issue is a little different.
Now, that's because right now the federal government pays about 73% of the premium, while members of Congress and their staff pay 27%. If staff members are forced into the exchanges, the cost to them may rise sharply, meaning they'd have to pay more, while other federal employees doing similar jobs would not.
The staff members, the people making $25,000, $30,000 a year in some cases, should not have to take a huge pay cut relative to other federal employees because of the way the law is written.
If they don't get that contribution to their premiums, their pay is effectively going down by, say, $10,000 a year.
But if the exchanges are that much harder on congressional staff and the subsidies are not large enough to offset the higher costs, how will they work any better for all the other Americans who go on the exchanges? Jenna?
A big question ahead for the next several months. Jim, thank you.
You bet.